Hello everyone, my name is Dr. Ng Wai Chong from South Foundation. I would like to share with everybody how can we enjoy a good night's sleep, and especially now that there is a circuit breaker due to a pandemic caused by a coronavirus ravaging the whole world, and Singapore is also badly affected. And so for this, I'd like to share with everybody some slides that I've prepared. So how does the global pandemic, COVID-19 pandemic, affect our sleep? So we know that COVID-19 is an illness affecting the respiratory tract caused by a coronavirus, which is highly infectious, and the disease can be very serious for seniors especially. And because of this, rightly so, that all government in the whole world are implementing policies that mainly covers areas such as social distancing, wearing of masks, washing our hands frequently using soap and water, and then extensive environmental sanitization, and contact tracing and case isolation with quarantine orders, so that people who are contagious, they do not spread the disease to others. And this has greatly impacted our social life and also the economy of the country, because there are many shops and industries are closed. So people do not travel, we don't go to restaurants, we don't meet with our friends, and because of the various policies such as working from home and home-based learning, so adults and children and the seniors alike are all staying at home almost 24 hours, 7 days a week. And this has resulted in quite a lot of new living situations affecting particularly the seniors and the caregivers. Of course, people of all ages are affected, but I would like to focus on the seniors and the caregivers. So how are they affected? So these are just some examples. Many seniors like to go to coffee shops, to community clubs, and to go to the parks to practice exercises and qigong. But now they have to cut down, and they can't do such activities that they usually enjoy. They can't enjoy the routine of going out for walks. And many vulnerable and disabled seniors, they can't attend daycare center, and because many of the daycare center have to stop operation just to reduce the chance of spreading among the seniors. And many of the nursing homes where many of our very disabled seniors stay, they do not allow visitors like family members, and surely the families as well as the seniors must feel quite a lot of sense of loss as a result of this. And many of our seniors cannot meet their extended families like their grandchildren and their other children and relatives, and also their friends. And sometimes seniors worry over whether they would catch the virus, or that they might catch the virus inadvertently and then spread it to their family members and loved ones. And of course, they also worry about their children's job security. And also, if our apartments, usually our children or our grandchildren are in schools or at work, it's a bit quiet in the daytime, but now everybody stays at home all the time, 7 days a week. And sometimes there could be a lot of interpersonal friction and conflict may arise as a result of this living situation. And because of all these, even as a doctor in the clinic, I do see more seniors coming to me complaining of boredom, loneliness. Some of them have got anxiety and worries. They are not able to adjust to the new situation so easily. So, and many of them also develop low mood. Some of them even have depression. And because of all these stress, many people find all these have affected their sleep. So either they couldn't fall asleep easily, or that they can't stay asleep through the night like before, and they wake up very early in the morning. But of course, apart from such a psychological stress that affect our sleep, there are many other causes of poor sleep. So let me just talk about the other causes of poor sleep before I share with everybody how can we manage our day-to-day living so that we can have a better sleep at night. So what are the other causes of poor sleep apart from the anxiety and stress caused by the new living situations? So there are many medical conditions can cause poor sleep. For example, some lung diseases that make us feel breathless, and heart diseases, particularly if you have heart failure, you may have difficulty lying down to sleep. Or if you have some kind of chronic pain syndromes affecting your joints or your neck or your back, you may find it difficult to sleep. And if you have got severe itch or urinary problems when you have to get up frequently at night, or that you have got acid reflux, when you lie down, the stomach is too full, and then you feel indigestion symptoms, it may affect your sleep. And some neurological conditions like stroke and Alzheimer's disease affect our biological clock and our natural sleep pattern. And psychiatric conditions like depression and anxiety can affect our sleep frequently. And medications such as stimulant drugs is frequently found in over-the-counter cough and cold preparations. Alcohol can affect our sleep. Nicotine found in cigarette smoke, and caffeine. And of course, there are other sleep disorders like obstructive sleep apnea and situations that affect our biological clock, like if someone were to who have been working on shift duties, and then their biological clocks are affected and they can't sleep very well at night. So how do we sleep well without using medications? So I'll just share with everybody some tips about sleep hygiene, and I hope that this will help all of us to sleep well. So first of all, of course, it's recommended that we should have 8 hours of sleep. But if you find yourself waking up in the morning feeling refreshed, there's no need to stay in the bed longer than you need to. So you could just get up and do your usual daily routine. And it is good to keep a regular sleep schedule, like you go to bed at a certain fixed time and you wake up at a certain fixed time. And do not try to sleep unless you feel sleepy. And exercise regularly, especially in the daytime, will help. However, do avoid exercising 4 to 5 hours before your bedtime, because exercise can energize our body and make us feel energetic, and this will affect our sleep. We should also avoid caffeinated beverages such as coffee and tea, particularly green tea, near bedtime. So preferably after lunch, we don't drink anything that contains caffeine. And we should avoid alcohol near the bedtime. Although alcohol can make us sleepy, but the quality of sleep is not good, and we can wake up in the middle of the night. If you drink too much, you can even have dehydration and headaches. Don't smoke, because nicotine in cigarettes is a stimulant, and smoking is bad for our health in many ways. And don't go to the bed hungry, because it's very hard to fall asleep if you feel hungry. But of course, we don't go to bed with a full stomach, because it increases the risk of acid reflux. And for a bedroom, it's good to make the environment conducive, so it's sufficiently cool. It should be dark, and if there should be some kind of night light, it should be faint, and it's preferable that it's yellow and not a fluorescent lamp, which can affect our natural sleep hormones. And we should avoid prolonged use of light-emitting screens like our mobile phones and like TV. And of course, we do have worries. Everyone has worries. And so deal with your worries in the daytime. Don't bring it to your bed, because thinking about it will just affect your sleep and make you less efficient the next day to solve your problems. And we it's also good to condition ourselves to, when we lie down in bed, we just feel like sleeping. So we don't do other things on the bed, like watching TV or use our mobile phone or eat or think over things. If you can't fall asleep after 20 to 30 minutes, then get up and go to another room until you feel sleepy. And so, as I was saying just now, that we should keep a schedule of sleep and wake. So even during the weekends, we should fix our alarm clock to wake up at a fixed time. And don't take naps in the daytime. So after, if you can do all these, it will somehow condition ourselves to sleep naturally. But sometimes we do need to see a doctor. So when are the times that we should see a doctor? So if you suspect that there are medical conditions that cause you to have poor sleep, for example, you feel that you feel breathless when you lie down, or that the itch is affecting your sleep, or that you keep going to the toilet through the night, so you should consult a doctor. Or that you have so much worry and you can't sleep very well, despite trying all the method that I mentioned earlier, and you still can't fall asleep, or you can't stay asleep, then you should see a doctor. So that's all I have today to share with you, and I hope that you can have good sleep and good and healthy life ahead of you. Thank you for listening.